Hello and a very good afternoon to all our viewers who are joining me in this live interaction on News9's Facebook as well as YouTube page. Well guys, the world is eagerly waiting to see which vaccine passes the litmus test to be declared as an approved COVID-19 vaccine. And even as the wait is on, India is currently utilizing its time to ensure that the back-end infrastructure is ready to deal with the supply and also the storage challenges. Now in the latest, the Union Health Ministry has asked states and union territories to start preparing with the supply chain for the COVID-19 vaccine, and also a new vaccine would require meticulous planning and also operational facilities at different levels. So communication to state governments and union territories, mission directors of the National Health Mission and the Central Health Ministry said a robust mechanism for the storage of vaccines and also maintenance of cold chains is very imperative, and states have been further also told to identify the sites for bulk storage of cold chain equipment, and also in order to keep ready all the cold chain points for installation of new equipment as well. So the center will also ensure that the states have bulk storage cold chain equipments like walk-in coolers, walk-in freezers at the level of state vaccine stores, regional vaccine stores, and also at a short notice. So the state is also ready to provide the supportive supervision mechanism, which is a strengthened mechanism using mobile-based apps. So in order to answer a few questions which surround this particular directive issued by the Union Health Ministry, we have with us Dr. Sitesh Roy. Many thanks for joining me, Dr. Sitesh Roy. And my first question to you today is, Doctor, could you please shed light on the directive which has been issued by the government?
So, Deepak, firstly, it's important to understand what the cold chain is and why it is so important, because having a successful and safe vaccine is one thing. And getting the vaccine to 1.3 billion people in India is a second thing. And so for most of these vaccines, the stability of the vaccine is best maintained between 4 and 8 degrees Celsius. That's been the story with the majority of the vaccines that we use currently as doctors around the world. However, with COVID-19, there are new technologies of vaccines that are available, and some of these vaccines are going to require sub-zero temperatures to maintain their stability. It has been suggested that some may require minus 20 to minus 30 degrees Celsius, and one even requires minus 70 degrees Celsius, which is an mRNA vaccine, because they tend to be very sensitive to temperature fluctuations, and the proteins in it can degrade if they get heated above that temperature. And so it becomes extremely important that if once we get the vaccine, an effective vaccine, that it is taken to the end user, which means our Indian populace, in a safe and stable manner, so that when it is given to the person, it is effective. Because if the temperature goes above the recommendation by the manufacturer, then the vaccine can get inactivated and it may not work for the person receiving it. And hence the back-end infrastructure directives that have been given by the central government asking the states to provide their entire plan on how they plan to receive, store, and then transmit and distribute the vaccines down to the very basic single individual needs to be highlighted and completely written down. And this plan needs to be submitted by each state to the central government by the 15th of October. And I think that this is an extremely important directive, and I'm very happy to see that India is taking a well in advance lead, because we may not have a vaccine before the start of the next year. But if we have the mechanism and machinery in place, then we can certainly do a very good job with its distribution, so that our people can get a safe and effective vaccine which is stable till the end user.
Now, Doctor, like you mentioned, India is now utilizing every bit of time it has to ensure that the supply chain and also the cold storage is ready for a vaccine if it is approved. So, what should be the structure of the supply chain, and which are the points where cold storage is very important? Like, which are the nodal points? Doctor. Well, there seems to be a technical glitch. Like the doctor mentioned, now that a vaccine is still in the development stage, all India could do is plan ahead for when a vaccine comes. So when a vaccine comes, it is very important for the health infrastructure in the country to ensure that each and every person across the country gets a vaccine, because this time we are not talking about a flu vaccine which will be administered to a given population, but we are talking about a COVID-19 vaccine which is very important for the entire nation. And in order to ensure that the vaccine is reaching every single person at every single level, whether be the state, city or even the village level, we need a structured supply chain and also well-equipped cold storage facilities. So now it looks like we have Dr. Sitesh Roy back online with us, or maybe a couple of minutes more we'll get Dr. Sitesh Roy back online. So how important is the cold storage? Now, if I have to talk to you about the cold storage, well, every particular vaccine is meant to be stored at a given temperature, which is in sub-zero. Like Dr. Sitesh Roy mentioned, cold storage is very important, and cold storage should be set up at every single level, be it at the state level where a big warehouse or a cold storage facility will be set up, and from this cold storage facility it will then be distributed via cold storage vans, which will also be delivering the vaccines to the most remotest areas across the states, across villages and also across cities if there are any. So cold storage is very important at the state level, and also now when we speak about the village level, when although the threat of COVID-19 is not as much as it is in the cities, in the villages, cold storage is very important, because even a small outbreak could also risk the lives of hundreds of people. So in order to deliver vaccines to these people in the rural areas, even the state administration, or rather the district administration, is set to set up cold storage at the district level, which will be helpful in facilitating the district crowd with the vaccine. So apart from the state and the district level, even some of the most hot spots like Bangalore is one of the hot spots in the country as well as the state. So although Bangalore has a space crunch, the state government will have to look out for the sites, identify these sites and make sure that the facilities will be given to the city as well, the cities which are mostly affected by COVID-19. So the state government will have to identify hotspots, and in these hotspots they will have to identify sites where they can have a cold storage facility, and after setting up a cold storage facility, the vaccines will be delivered to the mass. Now, looks like Dr. Sitesh Roy is back again with us. So, Doctor, now a lot is being spoken about the cold storage and also the supply chain, but what about the disposal point? Shouldn't that also be an important part of the exercise?
Absolutely. So safe disposal of the vaccine equipment requires special environmental waste, what is called biomedical hazard waste disposal systems. And because we have a universal immunization program in place, these systems are already in place, though the volume that we will be using with the COVID-19 vaccination program will be much higher than what we have seen with the UIP, Universal Immunization Program. But I do believe that with that, we will be able to see a good response, and we will be able to upscale our work and upgrade it to meet the requirement of the volumes that the biomedical hazard waste will require.
Now, Doctor, across India, we will have to set up more number of facilities, and more number of facilities involves more number of human resource. So how would the government train, vaccine and cold chain handlers, vaccine and cold chain managers, program managers, and also cold chain technology managers? Because all of these, specified managers are very important at all the levels. So do you think that it is too late for the government to start the training process, or do we have more time? Well, it looks like we have a technical glitch, but like I mentioned earlier, in order to operate these cold storage facilities and also in order to operate the cold storage programs, we will need a bulk of human resource, very specified technicians who will be able to handle these cold chain technologies, and for that we will need specific managers, program managers, cold chain managers, because these are the ones who will be well equipped with the kind of knowledge that they have in order to maintain these cold storage facilities. So the government is also now looking at a state level where the Union Health Ministry has advised the state health departments to ensure that the training facilities is given to all these specified technicians, because at the end of it, once the vaccine reaches the cold storage facilities, we will need all these technicians because they know their job, and they will play a very crucial role in maintaining the efficacy of a vaccine, at what temperature it has to be maintained, and also how it will be supplied to the end consumer, which is the people. So these human resources are also very important. Now, when it comes to when it comes to the public-private partnership, even the people's role is very important in playing a role in this particular directive which has been issued by the union government. People have to understand and also help the government in identifying some of the safe spots where the cold storage facilities can also be set up, and through these cold storage facilities the vaccines will be made available to the people. So now with this directive by the union government, some of the infrastructural problems are also highlighted. So what are these infrastructural problems? So in order to answer this particular question, we have Dr. Sitesh Roy joining us back. Doctor, do you think that this particular directive has underlined the infrastructural problems that the country is currently facing?
Absolutely, Deepak. I think that the infrastructure, especially at the village level, the rural areas, is something that we have clearly gotten highlighted through this process, since the volumes that will be required in rural India will be much higher than what has been seen before. And so the electrification of the villages, because those are required if you have to have a cold storage that is functional there, where thousands of vaccines can be stored, and also the need to have enough healthcare professionals who are trained in providing the vaccination for the masses. All of these are already in place, but would require significant upscaling as we get prepared to do a mass vaccination program. We do have to remember that right from the point where a vaccine through possibly the COVAX Gavi program comes from abroad on a Boeing plane, all the way through the storage facilities, through the trucks, through the tempos, through the smaller vehicles that would be transporting it, all the way to the storage at the district and then the zonal levels, would be extremely important for this vaccine to reach in a stable form to our basic rural populace. The good news, though, is that COVID-19 has so far largely affected cities and towns with larger population and more crowding, and hopefully our rural villages will be protected somewhat from the COVID-19 attack or onslaught, till we are able to get our infrastructure in place and protect our rural populations just as much as we protect our cities and our towns. Because India is, after all, an agricultural country, and we absolutely have to take care of our farmers and their families and all the people living in the interiors of our country.
Right, Dr. Sitesh Roy, many thanks for joining me in this live interaction. Like Doctor mentioned, the infrastructure is very important. If you could remember, during the outbreak of COVID-19, the healthcare infrastructure of the country was down to its knees. But over time, India, the government, the central government made sure that every single facility is made available now. The testing has been ramped up. Hospitals which ran out of beds have sufficient beds to treat COVID-19 patients. So in a similar fashion, now India is utilizing its time to set up the cold storage facilities and also to put up, or rather set up a good supply chain management. So with a COVID-19 vaccine in the near future, which is yet to come, India, we think, has ample amount of time in order to build the infrastructure that it needs and order to set up all the facilities that it needs. So we hope that the central government is successful in its attempt to set up all the facilities that we need in order to make sure that the vaccine reaches to every single person across the country. So if you guys have liked this piece of information that we've shared with you all, please do drop in your comments, and also do not forget to like, share and subscribe to News 9 on various social media platforms. Many thanks for joining us.